A stomach ulcer is a sore in the lining of the stomach. Normally, the stomach produces strong acid to help digest food. This acid breaks food into smaller particles, making it easier for digestive enzymes to break it down further. To prevent this acid from damaging the stomach itself, the stomach lining is protected by a thick layer of mucus that acts as a barrier. But when this protective mucus layer becomes damaged, the acid can come into direct contact with the stomach lining and start to break it down, much like the way it digests food. The most common symptom is pain in the upper abdomen. Interestingly, some people find that drinking milk brings temporary relief. That's because milk can briefly coat the stomach lining and neutralize some of the stomach acid, easing the pain. Other symptoms may include bloating and nausea. In more severe cases, ulcers can bleed, which may lead to dark stools or vomiting blood. The two most common causes are an infection with a bacterium called Helicobacter pylori and frequent use of anti-inflammatory drugs like ibuprofen or aspirin. These weaken the protective mucus layer, making the stomach more vulnerable to acid. Smoking, alcohol, and stress can worsen an ulcer, but they're rarely the root cause on their own. If you have an H. pylori infection, you'll usually be prescribed a combination of 2 antibiotics, taken twice a day for a week, together with an acid-reducing medication. This combination therapy helps eliminate the bacteria and allows the ulcer to heal. If the ulcer is linked to medications like aspirin or ibuprofen, treatment usually focuses on acid-reducing medication, and doctors will strongly advise stopping the offending drug. The most commonly used acid-reducing medications are proton pump inhibitors. The name proton pump comes from a tiny molecular pump in the stomach lining. This pump moves hydrogen ions, also called protons, into the stomach, and these protons are what make the environment highly acidic. Proton pump inhibitors block this step of acid secretion, creating a less acidic environment. This protects the ulcer from irritation and gives the stomach lining time to heal naturally. The downside is that these medications can take several hours to start working. That's why doctors may also recommend an antacid, a fast-acting medication that neutralizes existing stomach acid. This provides quick relief while the other treatments begin to take effect. Want to see what happens to your food after you swallow it? In the next video, we follow its journey through the entire digestive system.